My name is Pavan. I'm going to be interviewing a pulmonologist, Dr.K.SRIKANTH of Hindustan Hospital, Coimbatore. He's actively researching about the COVID-19 situation. So, what were your first thoughts during quarantine? Your initial thoughts?
Hi, Pavan. Thanks for asking me to be here today. Yes, we have. It's now almost 1 year since COVID has been in India. And initial thoughts on quarantine was one of fear. It was the first one was we all of us, including the doctors and the healthcare. No, it was more of a fear factor which was operating because two factors really was up in our minds. One was it's a new disease. If the pandemic hits the country, how are we going to treat our patients? How are we going to have the infrastructure for this? Do we have the capacity upfront? Secondly, will on a personal level, whether we will get affected as doctors, as patients, as our own staff can get infected with COVID. So what happens if we fall sick, and then then my family members. So that was also there was a personal angle also to this whole problem. So that was the initial thoughts.
Right. And how long did you think it would go on for?
Well, honestly, I thought it wouldn't go beyond June in February, but now it's we are nowhere near. We've
Yeah,
come much
close to
beyond
that.
that. Yeah. So initially, I thought
Mm.
it was because our initial experience was with similar pandemics like SARS, which happened a few years back.
Yeah,
SARS
SARS.
also was a bad one, and it was really
Mm.
not. It didn't hit India in a big way, and 2-3 months we were talking about it and just went away. So initially, I also felt that maybe India will not be affected and this should be a passing phase.
Right. How has this situation affected your like your social and financial life?
Yeah, it's a good question. In the early part of COVID, say February, March, April, May, I would say that there was a huge impact on all of us. Many hospitals, I mean, for the first time, we saw hospitals being shut down because this COVID situation was so scary that a lot of patients with COVID had to be treated separately. You need to have separate wards, separate infrastructure, and a very perfect quarantine system for these patients because we didn't want the regular patients to be infected with COVID. So a good number of hospitals were not able to rise up to the occasion, and a lot of people had actually were jobless. It was very surprising that even though there was a pandemic in front of us and we had to be doing something, most of us were actually jobless. In fact, the paramedical staff and the nursing staff had a very tough time at those time. And social isolation, well, I don't think personally I had a social isolation because since we were in the forefront, actively involved in the management, of course, was really totally cut off from my friends and relatives in other ways. The only people I was meeting was my own colleagues and only those people who were involved with COVID. So that way there was a social isolation. Financial
Yeah,
implications were
totally
there in
agree.
a large aspect was there, and it was really tough for us to keep our staff back so that we could keep them on the job. And these things really changed, say after June. Things were much better. The first few months were really tough.
Mm. Yeah, but yeah, slowly as you know more about the situation and eventually, it's more beneficial, like in
Yeah,
hospitals.
true.
So
The
yeah,
disease which was so new to us, but thanks to the current information, internet, and all those technologies which help you to get information from every part of the world. So the disease basically, started in
right.
China and spread to Italy and Spain in the early part of 2020. So a lot of information kept coming to us about the disease. We came to know that the disease is not only a pneumonia which affects the lung, it can also affect other parts of the body. It can affect the blood vessels, it can affect the heart. So much of information came through. And as information kept coming, the medical community was able to understand how the virus behaves, and we were able to get ready with our own treatment plans. So that way, by June, July, I think most of the country was literally ready with some good protocols to manage the disease.
Right, yeah. So, there have been reports of a new variant of COVID-19 spreading in the UK, right? If I'm correct. So, how would this vaccine sort of, will it cover that?
Well, this is again a very important question. So, right now, what we need to understand is that India has had its first wave, and uh, thank God that it has sort of settled down. Today, as I'm talking to
Mm,
you, the number of COVID patients in India is definitely very low. UK has been reporting this new variant. The new variant, as per the information available, seems to be more infectious than the parent virus. But there is nothing to
right,
suggest that this is going to be more virulent or more lethal in any way. And the vaccine manufacturers have confirmed that it is most likely this will be effective against the new virus. But again, we don't have data for this. But we hope that the science behind making of the present vaccines is in such a way that the Pfizer mRNA vaccines or the Oxford vaccine, both of them hopefully should be effective against the new mutant virus. But we will know exactly
right.
only with
So,
some time.
yeah, time will tell, yeah. So, uh, at the beginning of quarantine, very little was known about this virus. I mean, the parent virus, right? Uh, so, like, as a doctor, how did you deal with helping patients? When like very little was known at the beginning. How did
Yeah.
you manage?
Yeah, very little was known. But as I said, by the time India had a big impact on COVID, I think fair bit of information was available. For example, to give you an example, there are a couple of medications which we knew worked. For example, the role of steroids. So we use this intravenous
Right.
steroids. We realized that it can reduce the mortality, not in all patients, only in
Mm,
those patients whose oxygen levels are low. And we also knew that we should not be giving steroids when the oxygen levels are normal. So that information was obtained from
mm,
one trial from UK. Secondly, we also knew that COVID was causing the blood to clot. So when the blood clots, it can
right.
cause a lot of complications in the heart and all over the body. And we have medications which can prevent this clotting. We call them blood thinners, heparin. So again, the steroids and
Right.
heparin are available in the market. They are not new medications, but we realize that these medications could be used to treat COVID. And I feel these two interventions have played a major role in reducing the death rate. And then, of course, we did have
The
some
mortality.
antiviral medications also, like favipiravir, remdesivir, did come up, and so a lot of research was going on hand in hand. And as I said again, the information was coming very fast, and we were able to use it judiciously. And here, I would like to say that one of the most important things which helped us was to get organized. I think India had time,
Mm,
and we got organized. We all hospitals in India, including the government hospitals, really rose up to the occasion, and especially use of oxygen. See, oxygen was life-saving in COVID patients, and all hospitals were equipped with the state-of-art oxygen delivery machines. So I think these things really, really helped us save lives, although we were not having a specific cure. So in spite of not having a
right.
specific cure, we were able to reduce the suffering as well as the death
Mortality.
rate,
Yeah.
mortality.
Right. By preventing blood clots and because of the
Yes.
oxygen levels. So and even the virus hit India a little bit later, right?
Yeah. Yes, India. I
So
think,
by
of
that
course,
time,
Maharashtra had a very early impact. I think they were having a huge increase in cases in April, May. Chennai was badly hit in May, June. Coimbatore was peaking in July, August, September. So it was like, even now, if you look relatively, Kerala has still slightly higher number of cases. So it's like it's gone all over the place. It's not left anyone. Everyone
right,
has to go through it at least once. So that's the way it is. And I think the only way we can think of is once this settles down, and that intervening period is when the vaccination will roll in, and hopefully a lot of people will get immunized, and we will be able to get the herd immunity in place.
right. So my last question: have you developed any new perspective during the situation?
Oh yeah, it has taught us to take life the way it comes. We, as a medical student, we read about emergencies and pandemics. We have read about polio pandemic, smallpox. I mean, it's when you read it, it's history. It's the first page of a medical textbook. You just skip through it and go. It's not a typical exam question. You don't read it in that sense. So, having gone through a pandemic, it's a lifetime experience for a doctor, I would say. It's a really an experience which the learning has been tremendous in several ways. Our communication with the patients has improved. Personally, I feel I can now really understand the patient's perspective much better because of this. This pandemic has actually brought us very close to our patients. Secondly, we as a country, we really have to be geared up for emergencies. I think it's like getting ready for a disaster plan for a flood or a earthquake. One has to be ready for pandemics. So that's a very strong lesson and message which has come through this COVID-19.
Fair enough. That's all the questions I have prepared. Thank you for your time.
Thank you, Pavan. Thank you.